Dr. Khaled, thank you so much for joining us today for this Q&A. And we would like to talk a bit about endometriosis, as it is Endometriosis Awareness Month. So thank you for joining us today.
Thank you for giving me this opportunity to talk a little bit about endometriosis, which is a common condition affecting reproductive age women. And it is associated with many symptoms, but most importantly in our field, it is associated with infertility. So there is a significant percentage of women with endometriosis who are suffering from or having a delay in their pregnancy and looking for help. Endometriosis affects up to 10% of women of reproductive age. And there is some evidence that there is an increase in incidence. I'm not sure whether it is a proper increase in incidence or we are better at diagnosing it. And it can be a very frustrating condition. On average, it takes 7 years to diagnose endometriosis. And therefore, there is a push now to make the general population as well as the medical, I would say, community to be more aware of it and trying to diagnose it much earlier so that we can act upon it. It can be a difficult condition to cure, and it needs a lot of patience in order to control it, whether the pain symptoms and other symptoms are associated with, or whether to treat or help women to get pregnant.
And you mentioned that it takes a long time to diagnose, even though it's a problem that affects many women of reproductive age. I'm wondering, how can we diagnose endometriosis?
Well, the classical or the gold standard diagnosis is diagnostic laparoscopy, which is unfortunately an invasive way of diagnosing it. In certain situations, we can make a diagnosis by ultrasound scan when we find what we call endometriomas or chocolate cyst on the ovaries. In those situations, the scan is enough to make the diagnosis. But not uncommonly, there's no endometriomas, and the lady would present either with subfertility, but most commonly with pelvic pain, painful periods, heavy periods, and therefore the only way in those situations of making an accurate diagnosis is a diagnostic laparoscopy.
And do we know what causes endometriosis or why some women get it?
That's a very good question. Unfortunately, no. Despite being in the 21st century, we still don't know why some women develop endometriosis while others don't. There's few theories about how it comes or how it starts, but none is confirmed, unfortunately. It's more common in certain groups, like thin ladies. It's more common in thin ladies. However, it is also common in ladies with, or more common in ladies with polycystic ovary syndrome.
Okay.
Ladies with what we call irritable bowel syndrome, they have a high risk, and obviously those suffering from infertility have a higher incidence of the condition.
And how does it affect fertility? Is it the adhesions, or are there different factors that, how does it affect?
Different mechanisms, right? Now, obviously the disease can be mild, moderate, severe, in the sense that how much there is of the disease in the pelvis, but also how much adhesion it causes inside the pelvis. Now, if there is a lot of adhesion, it can affect tubal patency. If there is a big, for example, endometrioma or chocolate cyst on the ovaries, it can affect the reserve of the ovaries. But also, even if it's a mild disease, it still can be associated with subfertility. We think it makes the environment in the pelvis, that's around the ovaries, in the tubes, and so on, not favorable for the egg fertilization and probably also implantation. The exact mechanism we're not understanding. There is also some element of immune or immunological factors, that is an interaction between the immune system of the woman and the condition. It seems that that also plays a role. How exactly, we don't know, but there is some evidence that's the case also.
And once there is a diagnosis of endometriosis, how can you and clinics help patients increase their chances of having a baby?
Yeah, so again, it depends on the condition and how bad it is, right? Now, usually, if, for example, a woman had an ovarian cyst, a chocolate cyst, which is specific to endometriosis, if it's not too big, if it's not bigger than 4 centimeters, we don't touch it, because treating that cyst can damage healthy tissue in the ovary and affect the ovarian reserve, therefore affect the number of eggs that are present in the ovary. So therefore, we don't touch it. And we try to help either with, for example, intrauterine insemination, but the ideal treatment would be IVF-ICSI, because that will maximize the chances of success, and also it makes what we call one way of measuring success is the time to pregnancy. That gives us the shortest time to pregnancy. So yeah, if the financial situation permits, I would certainly recommend IVF-ICSI for those ladies.
And would women need to have surgery to remove endometriosis before treatment? Would that make any difference?
It depends again. So if there's no ovarian cyst, right, I would say that treatment of the endometriotic spots with a laparoscopy, where we diatomize, it's kind of energy we apply to the different spots of endometriosis, will give them a chance of spontaneous pregnancy also, right? It has been proved. However, that depends also on the age of the lady. So those above 35, and they've been trying for, say, 2, 3, 4 years, nothing happened, probably it's better to go for IVF-ICSI if they can. The alternative will be, diatomizing or treating these endometric spots and see what happens. Obviously, time is of the essence, and therefore they have to discuss it with the treating physician on what will be the best move forward. Yeah.
And when women get pregnant, is it a normal pregnancy, or do they need to be looked after with more caution?
No, once they are pregnant, I don't think there is any additional special care. No. However, there is some evidence coming now saying that ladies with endometriosis have a slightly increased risk of miscarriage. Okay. We don't know as things stand now, or what we can do to improve that. Maybe a little bit more extra progesterone can help, because sometimes there is evidence that ladies with endometriosis have what we call resistance to progesterone, so therefore they need a high dose. but that's again open to debate.
Dr. Khaled, thank you so much for answering our endometriosis questions.
No problems. You're welcome.